Hi, everybody. It's Adrian, Nurse Adrian RN here. I am a registered nurse. I have an MBA and I'm a board certified patient advocate. I am also a certified mediator and arbitrator, transformational trainer, and I'm the owner of Trusted Guardian Patient Advocates. I wanted to create this very short presentation to help people, especially those in healthcare, understand what patients are actually dealing with. Now, oftentimes we don't really, we're in a hurry. We may work in a clinic setting, a hospital setting, outpatient, surgical centers, public health. And oftentimes providers may not, be aware of what the patients are perceiving. And really, in order to get the best outcomes in care, it's important that providers and everybody who's involved in healthcare, from the person who's working the front desk to the techs, they understand what are the barriers and challenges patients face and deal with when interacting with providers and healthcare settings. So, this is really for everybody in healthcare, just to have a mindfulness of how am I interfacing with this patient, and is the way that I am interfacing going to result in the best understanding and best relationship, and am I building trust with the patient? So top here is obviously lack of communication between patients and physicians, and I would just say, and providers. So we can include nurse practitioners, PAs, those people that are seen as having the most authority from a patient perspective. And why is this? So patients may often feel that their provider, physician, does not listen to their concerns or questions, leaving them feeling frustrated and unheard. This is a very common complaint. I don't know the statistics on this, but I can tell you that it is a very frequently heard complaint by most people who interface with the healthcare industry, especially when they're just getting to an appointment and an outpatient setting, or when they're in a hospital. They may not even know which doctor's which. They may be asleep when the doctor came by, could be in the middle of the night. There's a lot of factors here. So it's really important that we are listening to our patients and at the same time doing what we can to manage expectations. But this is really key. And it doesn't actually amount to time, it amounts to the way we give feedback to patients and acknowledge. Another thing is unclear expectations. So oftentimes patients may not understand what is expected of them in terms of their own medical treatment and protocols. This can lead to confusion, a lack of understanding, and a lack of adherence. So I'll add this on the slide later. So what this means is that, does the patient understand their role in their own health? Do they understand what the expectations are of them? Have they, this may be basic patient education about taking medications. It could be about follow up. It might be deploying follow up calls for appointments, which many providers have now incorporated. Could be reminder text messages. And as well, it's very important to ask, do you have any questions? Do you understand your role in your recovery or in your health regimen, in the treatment process? Because a lot of people, were going into a place in America of having a myriad chronic illnesses that are going to be managed, medically managed for decades. So, given that, it is extremely, extremely important that we are able to clearly articulate to patients and have them reiterate back to us what their treatment plan is. And that could also include just keeping a journal and suggesting that to patients. Keep a journal of everything you're doing each day for management of these conditions. A big one that's come up now is implicit bias. This is nothing new. We deal with this constantly in healthcare, and some of us may have dealt with it with our colleagues, coworkers, providers. We may have been on the receiving end of implicit bias, or it could be overt prejudice. This is, again, the experience. So, again, it comes down to, what are we here for as individuals working in the healthcare industry? Are we here for patients? And if we're here for the patients, we have to be here for every patient, right? So bias can be inferred, anticipatory, and real. Bias towards historically marginalized patients affects patient provider interactions and can lead to lower quality of care and poor health outcomes for patients who are Black, Indigenous, people of color, BIPOC, LGBTQ, gender diverse. We could also add immigrant status into the mix here, which may also go along with being people of color, but it may not. It could be immigrants, Anglo immigrants. It's the or the inference of an immigrant status and what is your citizen status in the United States, whether or not you have insurance or not. So it's very important for each of us to say to ourselves and ask ourselves, what is my bias? Because we all have bias. Everybody does of some kind. This could also be class bias. It could be about financial. It could be how your patient appears. Again, check in because we all have bias. It's okay. The important part is we check in, we identify where our biases are, and then we start making corrections to those and how we are coming across to patients. Difficulty navigating the healthcare system is another huge one. Healthcare is not becoming simpler, it has become more and more complex for a lot of reasons, which is another whole video that I'll make about this. However, we all know, whether we're in healthcare or whether we are a recipient of healthcare, a consumer, how complex it can be, right? So, from the patient perspective, patients are having a very challenging time now to understand the different levels of care and processes involved in receiving medical treatment. And this can lead to delays and inefficiency. If patients are spending 6 hours to get to a 15-minute appointment on the phone with their insurance companies, trying to figure out who their providers are, what's the panel, which hospitals they can go to, which clinics they can go to, who's on the specialty list, then verifying that because often these portals are completely inaccurate and behind. So you could have a situation where somebody urgently needs to see a specialist or a physician or a provider of some kind, and they're on their portal, but the portal's out of date. They go to get that service. Oh, that person's no longer taking that insurance. Now they're going back home or they're on the phone in their car, spending often hours just trying to reach somebody on the phone. There's zero reason for the system to be inefficient other than to delay care and to discourage people from actually accessing care. Again, there's zero reason for this. We know this, we understand this. And at the back end, here we are as individuals involved with healthcare, having to attempt to mitigate those frustrations that patients experience. And they're coming into offices very frustrated often and just, as if they had just climbed Mount Everest, because that's what it amounts to. Combined with the complications in getting care, receiving care, and access to care and understanding insurance are the costs of care. Many people cannot even afford their copays. They cannot afford their own medical costs. There may be treatments that are not covered. There may be medications not covered. There may be supplies not covered by insurance, or they may not have insurance at all. And then how do we treat these individuals? Because we all know, those of us in healthcare, that those people are going to end up back in the ER. And they when they could have just had received the correct medical equipment or a prescription or a treatment or aftercare, physical therapy, OT, whatever it may have been, or it could even be transportation. So patients struggle to afford medical treatment and medications and DME. We'll throw that in, medical equipment, leading to difficulty in receiving adequate care. Thus, again, they are slowing down the healing process or the treatment process if it's a chronic issue. Here's another big one: understanding health insurance coverage, copays, deductibles. I don't even understand it. I don't even understand my own insurance, you guys. It's so hard. This is an entire language. In addition to the complications of, if people are changing jobs and they're in the middle of a certain treatment, then getting access and getting appointments in a timely manner to transfer their care. But then again, going back to the portals often don't match up to what is reality and who the panels are. in a insurance, and you may be on the phone with somebody who's reading off a different portal, and they may be inaccurate. They may be telling you that there's a facility nearby, and that may be 100 miles away because there's some mismatch with the address and the name of the either the provider group, hospital, clinic, whatever it may be, physical therapy center, some type of therapy center, treatment center. Same thing with DME supply companies. Same thing with home health agencies. It is very difficult. Well, let me say it's not difficult. It's made difficult for consumers because it's very simple on the back end if insurance companies would actually make it clear. And oftentimes, I've heard this from many, many of my clients that they cannot even get a full in writing copy of their policy from their insurance companies, which is abhorrent to hear that. So, providers may not take into account the healthcare coverage or lack when ordering diagnostic tests, labs, medications, procedures. So, this is a different thing. So, you have a provider who writes a maybe over the counter prescription, somebody's on Medicaid that may cover their generics of certain medications. However, the physician provider writes a prescription for the exact prescription name brand and doesn't put or additionally doesn't add on that prescription or substitute generic. This is so simple, and it honestly comes down to laziness. There's absolutely no excuse for a provider to not put that on a prescription, that a generic can be substituted. And it's also very important to understand what is the coverage of your patient. Are you ordering a lab that is not covered that could cost them a few $100s or a few $1,000s? Is it a diagnostic test that they may not be able to get for several months, thus delaying care, putting them back in the ER, and then they can't get an appointment again with a provider to do the follow up? Again, it's very important to understand on the front end what is the coverage of your client and the patients, and then take that into account when ordering labs, medications, procedures. Connected with that is difficulty in comprehending diagnosis and treatment plans, right? Health illiteracy is very common. The most educated individuals can be at the same time completely illiterate about their own bodies. So there is no assurances of any knowledge implied for healthcare or our own health status or understanding our own bodies, the health, the diagnosis, the treatment plans. We cannot make these assumptions. So education is so incredibly important for providers in every setting, anybody working in healthcare, right? I recently went to a doctor and had the person doing my intake of my medications make a comment about, oh, you're taking a lot of steroids. I take some allergy medications. And I asked them if what their training was to make that assessment. Now, they didn't have any. So and I'm not taking a lot of steroids relative to what many people take, but for certain allergy conditions, I do use a steroid inhaler. So, again, those kind of things can come off as biases, judgments, and make a person who is not in healthcare think, "Oh my gosh, maybe I shouldn't be on this," and then they may stop taking their own medication. So again, we must be educating everybody at every stage, every phase in healthcare about what's the language you're using, how is that impacting patients, and are we making sure that people understand every single component of their treatment plan? And are we using the appropriate tools, translators, language, visual aids to help them understand that? Patients may have difficulty understanding their diagnosis and the associated treatment plan, leading to confusion and frustration. Often, patients are asked to make quick decisions about treatments or procedures without understanding fully or when those decisions are being hastened for provider conveniences versus patient well being. So, again, if you're listening to this and it's on YouTube, make a comment and let me know what your experiences have been in a very short, concise way. Just use some of the key words that I've used in these slides. Yes, I've had experiences of not being educated. I don't need a whole story because there's nothing we can do with a whole story, right? But if there's something brief or short that you want to share, please do, because it's very important that we get an understanding here that, yes, we validate that this is actually the lived experience of a provider, of dealing with providers, seeing providers. And again, I'm using that term provider to mean physician, MD, DO. It could be a chiropractor. It could be, a nurse practitioner, PA, but in a traditional medical setting, right? And anyone that you're seeing, and especially specialists. So this leads also to time constraints, right? And the perception of time constraints. So we can be efficient and still be utilizing time, and in the outpatient setting, there's different ways that we handle this in outpatient and inpatient setting. Now, in the inpatient setting, the staff are being decimated, the support staff, and often it's only RNs left to do everything, beside, including even, cleaning a patient's room. So we don't often have CNAs that can also do certain parts of education about hygiene. We don't often have certain techs that can also assist with education or take some of that load off so that the RNs and LVNs can then do the education that they need and spend time with patients. Because if you don't spend time with patients, we're missing a lot of information. There is no substitute for spending time gathering data from patients to understand what their life is like, what their home setting is like, what their family setting, their psychosocial issues. You are going to learn about whether they go to church, how often they, get out of the house, who lives with them, what is the living situation, are there any risks in their living situation, do they need home health? There's so much data we're going to gather in these settings. So it's important that we not rush people, but we can figure out ways to be efficient about it. And that could be in the outpatient setting, having patients, fill out forms ahead of time if they can, or also identifying, are you unable to fill out that form and do we need to help you? So patients often, of course, feel rushed and hurried during their visits with their providers, leading to a lack of quality care. Limited access. Okay, so again, this is about who's insured, who's not. Do you have enough insurance? What is your coverage? Do you have the resources? And patients in rural or underserved areas may not have access to quality care due to lack of resources. This could be just a lack of providers. It could be a certain hospital system has a monopoly, and thus other smaller hospitals are closing. We're losing public health. I'm a big advocate of public health, of publicly funded public hospitals, public health clinics. When we lose that, communities lose a lot. Also, let's talk about stigma associated with certain medical conditions, such as HIV, such as different types of addictions. Patients may feel uncomfortable, ashamed, or embarrassed to discuss certain medical conditions, leading to a lack of treatment, leading to a lack of adherence to treatment. They may avoid treatment. Delays in seeing a provider and obtaining care can lead to poor outcomes and high cost of treatment and fear and anxiety. All right, let's move on then. So, fear of confidentiality is another one. Um, this may be with minors, it may be with young adults. And this really comes down to the providers being really clear with patients, especially if they may be on their parents' insurance up until the age of 23, if they are LGBTQ, or they're presenting with a certain medical condition. Now, of course, laws have to be adhere to. However, it's important for the providers to be upfront about the confidentiality, depending on the age situation. And this is all very subjective. So please make sure if you're a provider that, and if you're a patient, you're asking about confidentiality. And it's important that not to make assumptions about that, is information shared if somebody's in the room, if it's a spouse, a girlfriend, boyfriend, a partner, if it's a family member, sister, brother, whoever it may be. It's always very important for us to ask, hey, is it okay if I share this information and talk about this with you while this person's in the room? Even if it's a spouse, that person may not want that person in the room. And it's important that you go to the patient, you defer to the patient about confidentiality, right? So patients may be hesitant to discuss personal medical issues due to this fear of confidentiality being breached. General lack of education, knowledge deficit. We covered this already. I put this additional slide in here because patients, they may just not have the adequate knowledge about various medical conditions, treatments, and protocols, leading to a lack of understanding And this can also apply to clinical trials. This is super important for patient oncology patients. If the provider is suggesting that they join a clinical trial, it is very important that it is explained to these patients what those protocols are for clinical trials, because often oncology patients will not join a clinical trial because they don't want to be part of getting the placebo, which isn't the case for oncology drugs. And people do not understand that. They make the assumption that there's always a placebo group, which is not the case. So, again, these are some of the bigger topics that are barriers to care. I appreciate you taking the time to listen or watch this presentation. Please subscribe to my YouTube channel at Nurse Adrian RN. Join my mailing list at nurseadrianrn.com, and you'll be the first to be notified of free downloads and upcoming online courses. I'm a private concierge patient advocate and also transformational coach. Thank you so much. Go to my YouTube, subscribe, and enjoy my videos.